we're doing a new approach on counseling called collaborative care. And that's the idea of having counselors, therapists, other mental health clinicians stationed at the family practice itself. So that's to give the patients the one-stop shop of getting their physical and mental health supported in one space. So a little bit of my work with patients is that more counseling mental health approach. We come in, we talk about symptoms, coping skills, some other people processing trauma events, really whatever they're looking for. And then beyond that, I'm on an interdisciplinary team with the provider and the psychiatrist, where we talk about other ways that we can best support the patient, which can include medication management. So if a patient is looking for tailored meds or starting or stopping something, our psychiatrist is there for consultation. And then from there, the provider will present to the patient what was discussed and what we think may be best. And then ultimately, the patient has the decision of if they want to try it or explore other routes. So people can experience depression or anxiety without having an anxiety or a depression disorder. So coming in and having life-altering physical diagnosis, that's a lot to process and to understand. So being able to go to someone and be like, hey, I'm having all these emotions, these thoughts, and I don't really know where they're coming from or why or what they are. Just being able to speak it out loud with someone and having someone reflect back, like, oh, you may be anxious because this is something you're unfamiliar with, or you might be feeling a little bit down because your life might change with this new diagnosis, can really give you that extra pillar of support that people may not have thought about previously. I've been with VitalCare for about 2 years. And some of my very first patients I still see to this day. Others, it's we meet for a couple months until they feel like they're back up on their feet and feeling mentally stable. Some people are like, hey, can we check about once a month? It's more of like an accountability thing. Like, are you still using your coping skills? Are you still journaling? Are you still engaged in this community group? I know it goes back to whatever they're looking for. Having mental health services in the family practice definitely reduces stigma. So it encourages more people to reach out that maybe haven't. And then it also reduces that extra work that can be created in finding someone that's a good fit, finding anyone that's taking a patient. And then from there, if you are seeing a counselor or therapist, they may not do medication management. So then it is, all right, well, reach out to these psychiatrists, see if they can help you. And then you're working with 3 people who may not communicate with each other. So then you have that pressure of obtaining all this information, figuring out what works best for you, kind of on your own. So having it all in one spot takes that pressure off you. We have all of the documentation, the notes, the information on what you've tried, what worked, what hasn't. And obviously your input is the most important, but it's just everything in one spot makes it more convenient.